Hey, so when you have a health problem, it can be difficult to figure out where you should go. There's urgent care, the emergency room. You could set up an appointment with your primary care physician. A lot of options. Turns out there is a right and a wrong way to use them. 9 News medical expert Dr. Payal Kohli is here to give us some insight on where to go and when.
I'm so glad we're talking about this, Dr. Kohli. I've already been talking to her about my questions. But first and foremost, it seems like now more than ever, urgent care is kind of like the go-to for families or individuals. Why the popularity now?
Yeah, it doesn't just seem like that. They're popping up everywhere, Sam. And the reason is because they're very lucrative financially. Yeah. So hospital systems want to open them. But also if you think about it as a mom or as a dad, I mean, it's convenient, right? It meets us what we need. And it's what's called episodic medicine, right? Rather than longitudinal medicine where you plan ahead of time and it's chronic care problems. It's, hey, I need something today. I'm going to go get it. I can't get into my primary care. This is accessible. It's open on the weekends. It's open on holidays. Let me just go there.
There are limitations to each. What doesn't an urgent care do that, say, you could get at either an emergency room or your family care physician?
So can I start with what it does do? Because I think I want a glass half full here. It is a great resource for certain problems. Now keep in mind it's a little more expensive than primary care. So it sits between an ER and a primary care. So you're going to pay more for urgent care than you would for an emergency room. But let's say Sam here is hiking up a mountain, because she loves hiking.
I do.
And twists her ankle. This is a small, sudden onset, non-life-threatening problem where she needs to get an x-ray to know if it's broken. Or Phil here is cooking dinner for the family, like he does every night.
Every once in a while.
And he cuts his finger and he needs stitches.
Yeah.
That is a perfect problem for urgent care. Or let's say there's someone at home who runs out of their blood pressure medicine. It's Saturday night. They can't get a hold of their doctor. Go to urgent care, get a refill once in a while, not every single time. So quick onset problems for kids, obviously, if they have a fever, you're not sure if they have strep throat, if they have a rash, is it poison ivy, is it eczema? Those types of problems are great at urgent care.
So when should you, I think of my kids first, when should you go to the ER or I should take them straight to Children's Hospital?
So I would say if anything seems out of control, like in terms of the severity or potentially life-threatening. So if somebody faints, that is not an urgent care situation. I don't care if they saw blood, I don't care what happened. Usually you want to go to the ER. Somebody has severe abdominal pain. Urgent care does not have advanced imaging like CT scans or MRIs. It's mostly just x-rays. You're going to need a CT scan for abdominal pain, so you want to go to the ER. Anything that's concerning for appendicitis, anything that's concerning for life-threatening bleeding, or if you're an older adult that has a lot of chronic medical problems, ER is the place for you, because guess what percentage of urgent cares actually have physicians in them?
30%?
15%.
Yeah, I knew it was low.
That's it. So 15% of urgent care staff are physicians, and the rest are all nurse practitioners or PAs. So it really needs to be straightforward.
So I know that my wife and I did this when the kids were little. I'm sure you have. Everybody researches. They're physicians for themselves. They're pediatricians. How do you do that with an urgent care? Because they just kind of pop up. One's closest to you. You want it to be convenient, but how do you know if one's good?
So that's not the right way to do it. So the first thing that I would do is plan ahead of time, right? So you need to know which urgent care to go to if you need to. Best one is the one that's in network with your hospital, because then they have access to all of your records. The other thing you want to make sure to do is someone that can do advanced therapies like infusions, IV medications, and they have at least x-ray. Some of them don't even have x-rays on site. So you really don't just want to go to one near your house and say, oh, that's next to the grocery store, I'll just pop in there, because you'll get charged for having an encounter without actually getting any care. And the other thing here is the accuracy of the urgent care. So if you have the ability to research this, because they just did a study that said 2/3 of patients coming out of urgent care going to ER misdiagnosed. And urgent care uses more antibiotics than they should, more steroids than they should, and more opioids.
Well, it makes sense. There are not a lot of physicians there, right? You just said that. It's 15% of physicians. So what kind of care are you getting?
That's exactly right. So you want to be sure that it's a very easy treatable problem that's really straightforward. You're not taking complicated things over there. You're not taking your child who's having a seizure to urgent care. It's really just quick, need something quick and get out of there.
This was a great topic, Dr. Kohli.
Yes.
Like clear, concise, and now I'm going to research my nearest
I love it, Sam.
urgent care.
Love
Dr.
that.
Kohli, thank you so much as always.